Okay, what you may be wondering, what supplements, what are you talking about? Alpha lipoic acid is probably my favorite. This is a natural substance that is antioxidant to both fatty tissue and water-based tissue. So most antioxidants in the body are one or the other, like vitamin E is for fat, vitamin C is for water-based tissue. Alpha lipoic acid can go both ways, and so it's great for the myelin sheath, which is fatty for nerves, and also for the cytosol of the nerve cells themselves. So alpha lipoic acid is used in Europe as one of the first tier or primary ways to treat diabetic neuropathy and neuropathic pain. We offer it in both an oral supplement form through the Well Theory, which is my line of natural supplements, but we also have a way to give it to people with IV therapy. So we'll do a series of IV treatments of 600 milligram with or without B12, depending on what their needs are. And it's been dramatically helpful for patients with nerve pain, even things like residual sciatica, failed back syndrome. Think of any reason that a nerve might hurt, not just diabetic peripheral neuropathy, but alpha lipoic acid is great. Palmitoyl ethanolamide, this is a fatty acid amide. It's in the same family as cannabinoids, right? So it's in the endocannabinoid family. This thing, PEA, dramatically helps your brain, but also treats nerve pain. Why? Because it prevents the inflammatory response around the peripheral nerve endings in the setting of chronic inflammation and oxidative stress, which is what we're talking about. So the combination of ALA and PEA is very powerful for neuropathic pain. I also like omega-3 fatty acids because that just makes you naturally anti-inflammatory. And of course, D3 is massively important. So for neuropathy, we talk about it, ALA, PEA, the B vitamins, D3, omega-3s. That combination is very, very powerful to assist your nerves to get better on their own if it's at all possible. Now, for wound healing, one of the things that you need that is often forgotten is protein. One of the markers we look at in serum is levels of albumin, which is a type of protein. And if you have low levels of albumin or prealbumin or low levels of lymphocytes, these are markers of malnutrition. So protein, you have to have protein, the amino acids in the protein that are used to rebuild the collagen, the connective tissue, and the extracellular matrix we've been talking about this entire talk. So you have to have enough good protein intake for proper connective tissue healing. You've got to give yourself the collagen backbone. This ends up being about 3.52 ounces for every 150 pounds for a male. So it's not a ton of protein. This is just the replacement, like what you would lose on a normal daily basis. So you probably want a little bit more to heal a wound. But just don't forget protein. If you're going to eat meat, animal products, try to make sure they're organic, cage-free, grass-fed, grass-finished. Stay away from anything that's been fed GMO corn or soy. And then if you can, go with the plant-based proteins. But I'm a big believer and love eggs, grass-finished red meat. Like I have no problem with healthy animal proteins in moderation, of course. But there's plenty of protein found in things like edamame, shiitake mushrooms, lentils. There's a million plant sources of protein, so don't forget those.